Hello everyone, I'm Miloni Sanghvi, third year dental student at NYU Dental School, and I'll be representing my colleagues Dhrumi, Shah and Vyoma Patel as we present a research on a study of C-reactive protein, lipid metabolism, and peripheral blood to identify a link between periodontitis and cardiovascular disease. So, as we all know, periodontitis is a chronic inflammatory disease leading to attachment loss, and it is usually linked to systemic inflammation and elevated C-reactive protein. On the other hand, cardiovascular diseases are major global health burdens. So this study explores CRP, lipid levels, and blood counts as link between periodontitis and CVD. So the objectives of the study were to assess levels of CRP, lipids, and peripheral blood in periodontal patients and evaluate these parameters as potential biomarkers linking periodontitis to cardiovascular risk. So a total of 60 participants in the age range of 25 to 60 were divided into three groups. Group 1 had healthy controls, Group 2 had subjects with chronic periodontitis, and Group 3 had subjects with acute periodontal lesions. So the subjects that were excluded from the study were smokers, pregnant women, and those with systemic diseases. So the laboratory assessments were done as follows. CRP was measured with ERBA analyzer, and any reading above 0.6 milligrams per deciliter were considered. Lipid profile was measured with Cobas Integra 400 plus. Cholesterol, TGL, HDL, and LDL were included. Peripheral blood counts was measured with Sysmex XT 1800I, and hemoglobin, RBCs, WBCs, and platelets were considered. Coming to the results, so C-reactive protein levels in group 2 and 3 were significantly higher than group 1. Results for lipid profile, it was elevated in group 2 for cholesterol, TGL, and LDL, while there was no significant difference in the readings for HDL. And group 2 had decreased hemoglobin and RBC count, while it had increased WBCs and platelets. So, coming to the discussion, periodontitis induces systemic inflammation and it affects lipid metabolism. Elevated CRP and leukocyte counts may contribute to atherosclerosis. Anemia of chronic diseases is observed in periodontitis, and increased platelet count can suggest thrombogenic potential. So I would like to conclude saying periodontitis is associated with elevated CRP, lipid abnormalities, and blood changes. These biomarkers suggest a potential link to cardiovascular diseases, and it may serve as a cost-effective indicator of systemic risk. These are my references. Thank you.